Hi, this is Dr. Perry Carpenter. I'd like to thank you for taking the time to join me on today's program. Today's program is entitled the Ethics and Law Series, and today we're focused on the limited topic of unprofessional chiropractic conduct. Okay, now I want to move on to the sections of the Chiropractic Code of Regulations that involve drug or alcohol use, and we're going to spend a substantial amount of time on this section because the board has created no fewer than 3 subsections that relate to the use of alcohol, drugs, and or controlled substances. So let's spend a little time on this, and let's begin by reviewing very clearly the definitions of violations as described by the Board of Chiropractic Examiners. So under subsection F, the board talks about the use of drugs and alcohol. And it says that this is what qualifies as a violation. Here it is, and this is a quote. It's the administration to oneself. That's you and I, doctor. The administration to oneself of any controlled substance or the use of any dangerous drug or alcoholic beverages to the extent or in a manner as to be dangerous or injurious to oneself or to any other person or to the public, or to the extent that the use impairs the ability of the person to conduct with safety to the public the practice authorized by the license. So what's the practice that's authorized by the license? Well, that's the practice of chiropractic. So the board says here that if you drink alcohol or you use drugs or controlled substance in a manner to be injurious to yourself, to others, or to the public, and who are the others? Who would the others be? The others could be our staff. The others could be tenants in our building. Others could be vendors that deliver to our practice. Vendors could be salespeople that come to demonstrate products. Any other person or to the public is subject to discipline by the board. Now, this mostly refers to the doctor being impaired in the practice of his chiropractic practice, because it states here that the use of these substances impairs the ability of the doctor to conduct with safety to the public the practice authorized by the license. So that's talking about the practice of chiropractic. But that's not the only instance in which the board punishes for drug and alcohol use. Under subsection I, the board talks about other situations wherein they punish for the use of drugs and alcohol. For example, if you're involved with the conviction of more than one misdemeanor or any felony, and I interpret that to mean any single felony, involving the use, consumption, or self-administration of any dangerous drug or alcoholic beverage or any combination of those substances. So let's say that you are found guilty of a DUI. Found guilty of a DUI. That involves the use, consumption, or self-administration of an alcoholic beverage. The Board of Chiropractic Examiners considers that to be a violation. Whether or not you're driving to your office, whether or not you're driving to a lecture, whether or not you're driving to a seminar, this section removes the relationship of the chiropractic practice and defines the relationship as a general relationship. General meaning in your general life. So what does that mean, doctors? You cannot drink and drive. You cannot use dangerous drugs. You cannot self-administer any combination of drugs or alcoholic beverages. Oh, you can do it, but if you get caught and you're convicted of more than one misdemeanor or any felony, the board is going to consider you to be a non-chiropractor. Okay? They consider you to be under discipline. And I read to you earlier the disciplinary orders, and they are harsh and they are severe. So what the board is saying is they want us to be good people. They want us to be good boys and girls. Finally, the board states under subsection J that the violation of any of the provisions of law, any of the provisions of law regulating the dispensing or administration of narcotics, dangerous drugs, or controlled substances qualifies as a violation as far as the Board of Chiropractic Examiners is concerned. So I don't know all of the provisions of law regarding narcotics, drugs, or controlled substances. Do you? I don't know all of them. I imagine there's probably hundreds of provisions. And researching those is beyond the scope of this program. However, what the board is saying here, what they're saying is, do not be involved with dispensing or administering narcotics, dangerous drugs, or controlled substances. Now, I have for you defined here what qualifies as controlled substances. And we're going to get into controlled substances here in just a few minutes. And basically, many things qualify as controlled substances. And the board is simply telling us here that they don't want us as chiropractors involved with dangerous drugs or controlled substances, either in our practice or away from our practice. Now, let's talk about physician substance dependency. And it brings up an interesting point, and that is that we no longer use the term drug addiction, because that carries with it negative emotional connotations. Now, the current terms of use involve the term substance abuse and or substance dependence. And it's important for us to realize that substance dependence and substance abuse are not character descriptions. They're not descriptions of a weak will or a weak personality. Rather, substance abuse and substance dependence are thought of as neurologic and or psychiatric disorders that are basically like chronic illness. And these are conditions that physicians and people in general require treatment for. And they can no more cure themselves of these illnesses than a person with any other medical condition can cure themselves without appropriate medical treatment. So substance abuse and substance dependence is a chronic illness. And statistically, approximately 10% of Americans have a substance abuse problem at some point in their life. Now, physicians, and this is relating to medical physicians, that is, and we're just going to analogize to chiropractic physicians with a couple of exceptions. But 8 to 12% of physicians, which is higher than the prevalence in the general population, 8 to 12% of physicians will develop a substance abuse problem at some point during their career. At any given time, as many as 7% of practicing physicians, roughly 1 out of every 14, are active substance abusers. And in medical practice and also in chiropractic practice, chemical impairment has been shown to be a major risk factor for medical malpractice and negligence lawsuits. And that's the purpose of this program, and that's the purpose of the board requiring that we complete 2 hours of continuing education on ethics and law every 2 years, or every year. Now, as I said, substance abuse is thought of as a chronic disease and a chronic illness, and it's a neurologic and psychiatric illness, and it's contributed to by many factors which are beyond the scope of this program, but those factors include genetic factors, social factors, emotional factors, and psychologic problems. Now, let's define substance abuse and substance dependence, and we look to the authority of the Diagnostic and Statistic Manual of Medicine, 4th edition, for our definition of substance dependence. And the DSM-4 states that substance dependence is defined as a maladaptive pattern of use of a chemical substance within a 12-month period that significantly interferes with the person's life, as indicated by any one of the following. By any one. Doesn't have to be two. Any one of the following. Number 1, neglect of work, school, or home obligations. Number 2, recurrent use of the substance in hazardous situations, such as driving or operating machinery, or, in the case of chiropractors, while caring for patients, while treating patients. Number 3, repeated substance-related legal problems. Number 4, continued use of the substance despite recurrent social or interpersonal problems associated with its use. So let's summarize that. We could say that according to the DSM-4, substance dependence or substance abuse could be defined as repeated use of a mood-altering chemical despite adverse consequences from previous use. Now let me ask you, doctors, did you ever touch your finger to a hot stove? You ever touch your finger to a hot stove? What'd you do? What happened? You got burned, right? And when that happens to one of our children, don't we usually sort of inwardly say to ourselves, well, he learned that lesson. He learned about the hot stove. He won't touch the hot stove again because he sure learned that lesson, right? Despite the adverse consequence from previous use, those physicians and chiropractors and persons who are substance dependent, they continue with repeated use, even in the presence of adverse consequences of previous use. So let's put this in context. Let me give you an example. If you were drinking alcohol and driving and were arrested with a DUI, and you hear people being arrested for DUIs all the time, a person who then suffers a second DUI would qualify as a substance abuser because he got a second DUI despite the adverse consequence of his prior alcohol use, which was the first DUI. You follow that? See, the DSM-4 says that substance abusers continue to use the chemical even in the presence of adverse consequences at home, at work, in their family obligations. They continue to use the chemical substance while in hazardous or conflicting or contradictory situations such as caring for patients, and they continue to have adverse impact on their life such as recurring legal problems, and yet the use and the dependence on the chemical persists. Those are clear-cut signs that the physician is dependent on the chemical. Now, there are some characteristic signs and symptoms of substance abuse in physicians. And this is taken from the article that I referenced earlier. And this article is specifically directed at medical physicians because it followed over 900 medical physicians who were admitted to alcohol and drug rehabilitation facilities. But I've extracted out of this article those signs and symptoms that we can analogize across the professions, including chiropractors. So I'm going to describe with you, or to you, some of the signs of symptoms of substance abuse as those appear in a chiropractor's professional activities, as they would appear in his physical status, as they would appear in his relationships with his family and in social settings, and then also as relates to the chiropractor's professional history. So with regards to the chiropractor's professional activities, we might see that in a substance abusing chiropractor, we might see that the behavior toward the staff or the patient becomes somewhat different, somewhat unpredictable. We might see that the doctor closes and locks the office door frequently. Why would he do that? That's a sort of a distancing behavior, correct? We might see that the chiropractor is frequently late or absent, missing. Where's the doctor? Is the doctor here yet? Why is he late? Maybe he's involved in some activities that make him late. We see that there are increased patient complaints about the doctor. We may see that the work quality, including the quality of charting, quality of note-taking, the quality of history-taking, the quality of treatment starts to deteriorate over time. We may see that the doctor is either unavailable, or when he is available, his behavior is inappropriate, especially in situations when he's on call and perhaps not expected to be called in to render treatment. So those are some examples of how behavior and function deteriorates over time due to the ravages of long-term substance abuse. Now, physically, the doctor may show signs of deterioration as well, as evidenced by emotional distress or depression. We may see that the physician's health begins to suffer, and he starts to report frequent and multiple medical illnesses. We may see that the physician becomes susceptible and prone to multiple accidents and or other traumatic injuries. And as the condition continues to deteriorate, we see that the physician's or chiropractor's personal hygiene and even dress deteriorates. And so any of these, taken singularly or together, suggest that the doctor is not doing well. There's a pattern of deterioration and poor performance, and that evidences itself in his professional performance and also in his physical condition. Further, with regards to social and family settings and obligations, we see that legal problems become to be more prevalent, and the doctor is arrested for driving while intoxicated, or having other legal problems such as arrested for fighting or disturbing the peace. At home, the children may develop problem behaviors. We see that the doctor drinks excessively or becomes intoxicated excessively at parties or social functions, as a binge pattern of behavior becomes manifest and evident. We see that the doctor becomes more and more isolated and withdrawn from family and social activities, and again, this is another form of hiding and or distancing behavior, which eventually, of course, leads to marital problems and possible affairs and separations. And we may see the doctor engaging in unpredictable personal behavior, including high-risk behaviors and taking unnecessary chances and unnecessary risks. And then finally, as the problem spirals downward, we see that the doctor is involved with frequent job changes as they try to outrun and distance themselves from their worsening reputation. Many times doctors will change geographic locations entirely, moving to different parts of the state or even different states altogether. There may be unexplained time lapses between jobs, sometimes perhaps to complete drug and rehabilitation programs. And we see that colleagues distance themselves also from the practitioner, and the doctor is unable to provide definite and supportive letters of recommendation, instead substituting only vague or indefinite letters of reference on new job applications. Now, the Board of Chiropractic Examiners specifically references the use of alcohol, the use of controlled substances, and the use of quote-unquote dangerous drugs. Now, the term controlled substance is a very specific term, as is the term dangerous drugs, and those are specifically described in different sections of the Health and Safety Code. So I want to go over with you now the broad spectrum of substances that the board considers to be outside the range of use, of normal use of a chiropractor, and for which the board may take disciplinary action. So according to Health and Safety Code 11007, a controlled substance refers to a drug, a substance, or an immediate precursor, and these are all chemical precursors, analogs, isomers, enantiomers, and all of those chemical words that you remember from biochemistry that refer to drugs that are either analogs or similar to any substance that's listed in sections 11054, 11055, 56, 57, and 58 of the Health and Safety Code. And I'm going to go over each of those sections with you and describe those substances to you. And you may have heard of these before as the drug quote-unquote schedules. You may have heard of Schedule 1, Schedule 1 drugs, and Schedule 2 drugs, and Schedule 3 drugs. And so let's go through these very quickly here. Section 1154 defines the Schedule 1 drugs. Section 55 describes the 2 drugs. 56 describes Schedule 3 drugs. And then we have Schedule 4 drugs and Schedule 5 drugs. Now, the Schedule 1 drugs include forms of the following. And I say forms because as we go through the various schedules all the way up to Schedule 5, we're going to see some of these substances contained across multiple schedules, and that simply refers to different forms of these substances. So in the Schedule 1 category, we have the opiates and the opium derivatives such as codeine, heroin, and morphine. We have hallucinogenic substances such as amphetamines, LSD, marijuana, mescaline. And then we also have the depressants known as the quaaludes. And you've heard of quaaludes, such as mecloqualone and methaqualone. Those are the depressant substances, all of which are considered to be Schedule 1 controlled substances for which the board can take disciplinary action if you are found to be using, consuming, or administering these substances to yourself. And it's quite interesting, some years ago in my own chiropractic practice, I was involved in doing a lot of industrial drug testing. We had a large contract with several local supermarket franchises, and the franchises, which included approximately 30 separate individual locations, they would send their new hires to us for drug testing because they wanted to make sure that they were hiring people that were indeed drug-free. And I saw many, many people come and go throughout the office getting drug tested, all of whom were very nice people, but some of whom had stories and reasons as to why they could not produce a negative drug test or a clean drug test. And it was unfortunate to see those people lose job opportunities because of positive drug test findings. And it was very early on in those days that I realized the importance of keeping a clean drug test, because anything other than a clean drug test is controversial, and you may never ever be caught with a positive drug test, but that should not be your only motive to maintaining a clean drug test. And let me give you an example, and I'm sure you can think of many other examples as well. Imagine you're driving along, minding your own business, not doing anything wrong, not using any alcohol or controlled substances, and a child runs out into the street chasing her ball. And unfortunately, you can't stop in time, and you hit the child. And there's an investigation, including a drug test, and you're found to have marijuana, positive marijuana, as a result of some marijuana that you smoked over the weekend, 3 days ago, or a week ago, or 2 weeks ago, or I don't know, I'm making this up. But because of that use of marijuana, you have a positive drug test that then raises unnecessary controversy in the context of this auto accident. And so you don't want any controversy. You don't need any controversy. It's best to maintain a clean drug test, because a clean drug test is a positive objective finding, and it's a credibility enhancer, whereas a negative drug test is a credibility detractor. And I encourage all of you to maintain a clean drug test. And the board here tells us what types of substances they don't want to see us using. These Schedule II drugs include the opiates and opium and all the salts, compounds, and derivatives of opiates, including codeine, hydrocodone known as Vicodin, morphine and oxycodone, the pain reliever, cocaine, fentanyl, methadone, any of the amphetamines, and certain depressants, including the phencyclidines known as PCP. Class 3 drugs include any of the stimulants, any of the depressants, any narcotics such as codeine and morphine. And for those of you chiropractors who are athletic, it's interesting to note that anabolic steroids are classified as Schedule III drugs. Now, unless you are taking anabolic steroids under the prescription of a medical doctor, the use of anabolic steroids is a violation of the Board of Chiropractic Examiners rules and regulations. And if you are found to be administering these to yourself without a doctor's prescription, the board can take disciplinary action against you. Isn't that amazing that anabolic steroids qualify as a Schedule III drug? Because as far as the Board of Chiropractic Examiners is concerned, anabolic steroids can affect a doctor's behavior and a doctor's judgment by virtue of the action of testosterone on the behavior. So the board will punish for that. And then finally, all hallucinogenic substances are classified as Schedule III drugs. Schedule IV drugs include narcotics, depressants, fenfluramine, which is a weight loss medication, and other stimulants such as the amphetamines. Finally, the Schedule 5 drugs include the narcotic drugs that contain other non-narcotic active medicinal ingredients. And these narcotic drugs are mostly based on codeine, morphine, opium, and diphenoxin. And you've probably heard of Tylenol with codeine, and that would qualify as a Schedule 5 drug. So doctors, I hope this has been helpful for you. This is a brief program. It's not the typical type of program that I'm usually involved with. My main interest is in physical examination and anatomy, and you'll see that by looking at the courses that are on my website. However, I took this program on and created the Ethics and Law series to provide some real training and some real discussion for you and for me, and to keep fresh forever in our minds situations that could potentially jeopardize the exalted position that the public bestows upon us as doctors. The doctor title and the doctor position, the doctor stature, is legendary in the eyes of the public. And we need to acknowledge that and constantly keep that at the forefront of our mind and behave responsibly and always behave in the best interests of our patients. And so with that in mind, I created this series on ethics and law for both of us, as reminders to both of us to always be on the top of our game. So that concludes this course. I hope you learned some things from this course. Included with this course is a 5-question course examination. When you're done, please fax or email that back to me. I've included the email address here for you. For those of you that have the PowerPoint presentation, also have the fax number here for you as well. And just as soon as I get that course examination, I'll issue your certificate of completion immediately. And I want to remind you to remember to visit our website, which is easychiropracticCEU.com, for programs and products designed to help you succeed as a chiropractor. For now, this is Dr. Perry Carpenter. I'm looking forward to being with you on future programs. And for now, I'm wishing you best of success in your career as a chiropractor. Again, thank you very much.